Hi, it's Dr. Sweeney back again to talk about another medical subject. Today we're going to talk about leg swelling, particularly sort of swelling around the ankles. Now, if you have swollen ankles and it's affecting both sides equally, then that can imply more of a systemic effect, such as sometimes a low albumin protein level in the blood. Albumin's made by the liver. That can allow fluid to leak out into the tissues in your lower limbs because gravity pulls fluid down. It could be a sign of chronic venous insufficiency. As we get older, our veins become a little bit less competent, so blood can tend to pool in the lower limbs and cause leaking of fluid into the ankles and lower legs as well. Now you can tell it's water or edema by pressing in onto the swelling, and if you can leave a finger imprint, then that means that it is water based. If it springs back suddenly, then it's usually more just normal sort of body tissue. You can get ankle swelling from side effects from certain blood pressure medications. It can be, again, if there's bilateral, so both legs are swollen equally, it could be a sign of some heart dysfunction. If the heart is impaired in its pumping action, that can cause ankle swelling as well. And as I mentioned earlier, liver dysfunction can cause fluid to build up in the lower part of the body too. Um, so there are sort of some common causes of when swelling affects both legs. If there is one-sided or unilateral swelling, so just one leg is swollen, then common causes for that can include things like cellulitis, which is infection and inflammation of the skin. That's usually accompanied by a red, hot, shiny appearance, so that can cause some swelling. A Baker's cyst can rupture. A Baker's cyst is a little sort of pocket of fluid that can develop out the back of the knee capsule, often manifests itself as a lump behind the knee, which then can suddenly disappear, and then swelling develops as the fluid from the knee capsule itself leaks down into the lower leg. So it could be a ruptured Baker's cyst. And obviously, the main thing to be wary of is a possible DVT, a deep vein thrombosis. That's when you have a blood clot in one of the veins in the leg, and it can cause the leg to slowly swell. Particularly more common if you've had any kind of long-term travel, where you've been immobile for a long period of time, post-operatively, so after any surgery, you're more at risk as well. So if you do have a single leg that's swollen, or indeed both legs swollen, please get it checked out by your doctor. It could be one of the number of reasons that I've said, all of which are significant and should get checked out. So don't ignore it. If you do have swollen legs, one or both, either way, get it checked. Until next time, stay safe. See you later.